are involved, which is less likely with the intra-axial lesion, although you can have it enhancing in glioblastoma, which is having pile spread, or a gliosarcoma, or a PNET if they are close to the meninges. So you have to not decide only on the basis of this, but take this as one of the criteria for concluding that a lesion is extra-axial in location. A T1 weighted image where you see that there is displacement of the brain parenchyma away from the skull vault, so the expected location is not seen, but you also have a gray matter interface. We'll see that in the next images. If there are associated bony changes, you are more likely to be looking at an extra-axial lesion, mainly if there is destruction or hyperostosis. Scalloping can happen with lesions such as DNET, so that is not the main, but it can happen with lesions such as arachnoid cyst also. But if you are looking at hyperostosis or sclerosis or bone destruction, you are more likely or more confirmatorily looking at an extra-axial lesion. But you make an attempt to identify three structures: CSF, vessels, and how the dura is adjoining this lesion, and also deliberately look for whether there is a cortical lining between the mass and the white matter, which may be edematous or which may be normal. So let's look at some examples. A T2 weighted image in which you have a lesion with an attachment towards the forks, but how do we confirmatorily tell that this lesion is not involving the brain parenchyma is that there are 2 or 3 signs in this image. You have a CSF cleft which appears like a white rim between the lesion and the cortex. You see the cortex buckled up, so you have to imagine that this is where the cortex should have been as the symmetric opposite parenchyma, but it's displaced around while its integrity and architecture are maintained. So this is the important thing. When you're trying to look for displacement or of the cortex, the first thing that you want to see is that there is no compromise of the architecture of that parenchyma. It is just normal appearing but displaced. You have a vessel in between this lesion, as in seen better here. So you have phlovoids within the lesion, and you have the broad base towards the extra-axial components, which could be the meninges along the middle cranial fossa, and you have a gray matter lining with a CSF cleft. But you also have another sign here where you're seeing a vessel coursing between the cortex and the adjoining lesion. So these signs